Like when you take 60% of it, increases 60% for 500 milligrams dose to 89 for 1000 milligram dose. So it's dose dependent, and its plasma terminal elimination is almost 1 to 2.5 hours. So, and the volume of distribution is roughly 50 liters. So that's basically the pharmacokinetics, and it is more metabolized. Primary metabolism is done in the liver through mainly glucuronidation and sulfonation. So those are basically part of the pharmacokinetics. Minor metabolic traits. Okay, that is not necessary. So basically today I just wanted to take you through paracetamol as an acetaminophen, as a CNS drug that affect some part of the drugs that affect the CNS. So if you like the video, kindly subscribe, like and comment, and we interact. Amen. You all know health is a broad area, is a broad field, so I want to take you straight to what we're going to talk about today. So we're going to talk about drugs that are affecting the central nervous system. So what is the central nervous system? This is the driver of every aspect in our body. So today I want to tell you things that affect the central nervous system. Now, one of the drugs, the different types of drugs that work on the CNS. The CNS basically is the short form of the central nervous system. They include the anesthetics. Anesthetics, we have got the anticonvulsants, we have the antiemetics, anti-Parkinson's agents, and then we have got muscle relaxants, we have got narcotic analgesics, that is the pain relievers, the non-narcotic analgesics. That's where we have got the acetaminophen and the NSAIDs. So basically today, one of those examples, I want to talk about the non-narcotic agents, more so specifically speaking about acetaminophen. So today I want just to get there. Acetaminophen, that is paracetamol. So acetaminophen is one of the broadest and used universally. Different countries and different communities, different areas, regions use acetaminophen, commonly known as paracetamol. Now let's get together, stick on as we communicate about it. So before we go ahead, please consider subscribing, liking, commenting for improvement on this and many more videos. So guys, welcome. See you on the other side. Also known as acetaminophen. So we want to broadly talk about it, the uses, side effects, pharmacology behind it. Now, to begin with, paracetamol, also known as acetaminophen, is a medication. It is a medication used to treat pain and fever. That is moderate pain, and you see the common brand names worldwide. We have got Tylenol and Panadol. So mild to moderate pain. So mild to moderate examples of mild to moderate pain, we have got pain such as headaches, pain such as toothache, sprains, and it also relieves fever. Basically paracetamol, the miracle behind it is about the fever. So it relieves fever caused by illnesses such as colds and flu. So basically that is on the uses of it. And we have got just the examples that I've mentioned. To repeat myself, we've got pain such as fever, pain such as musculoskeletal pain, dental and other surgical pains, and generally other pains, cuts and stuff like that. Now let's get to the formulation, how paracetamol is available outside there in the market. So the different forms of paracetamol, it is available in form of a tablet or caplets. So a tablet is a formulation that looks like this. I have an example here. Let me show you. This is a drug from Ellis Pharmaceutical. Ellis is a company in Kenya. So this is a brand named Elimol. So it is in form of a blister pack. There are 10 pieces. So this is a tablet or a caplet, but it's a tablet actually. So I'm not here to promote any company. They have not called me to contacted me to promote them, but this is just an example. I'm using it as a basic, what I have in a basic setting, like in a health center in the village. So today I'm just using this as an example, but this is now a paracetamol. This is one form of formulation of paracetamol. Now the next one, we have got capsules. They are also formulated in form of capsules. I don't have one example. We have got liquid forms as an example of another formulation of paracetamol. So liquid, usually the liquid ones are for children basically, or those who cannot ingest or take in tablets. And then we have got soluble tablets, those that effervesce. I think one major example is Fevamol, things like. So it effervesce. You put it in a glass of water and then it dissolves, then you take it. Like, I think one example, for the soluble tablets, they are also in form of suppositories that are inserted at the back passage of patients, especially those who cannot ingest, kids and those adult patients. And then we have got another formulation, parenteral formulation, as an injection, also be in form of an injection where it is administered through veins. I think I have, if you can see where, vein, you can use my vein in this predominant one. You use it to inject, to administer, so that I get well, I reinstate myself. So that is just the kind of formulations that we have in the market, different brand names, like, just for example, this the Tylenol and the Panadol that we just talked about. And okay, then when we get to the adverse effects, so adverse effects, these are effects such as nausea, abdominal pain, which are common, and the frequency is similar to that of Brufen. Is an NSAID. So basically these are painkillers. So the GIT, the GE effects, gastrointestinal effects, the nausea and vomiting may occur as a side effect when you take in a paracetamol. And also there are some rare skin reactions that might also occur, the Steven-Johnson syndrome, then the toxic epidermal necrolysis, then the liver side of the abdominal liver function, and then there's also blood dyscrasia. So the next part I want to talk about is on chronic consumption. Sometimes you might be in severe pain or moderate pain, and then you think when you take a lot of paracetamol exceeding the strength or the prescribed dosaging, you get well. So when you do that, you just there are a lot of certain things can happen, especially in this case we are talking about hemoglobin level, drop in hemoglobin level. That is the drop in the blood pigment, the red pigment in the blood. That indicates that will increase the GE bleeding, you see, and abdominal liver function test might also occur. So out of that, we are taking you now to the pharmacology bit of it, where this is how pharmacology is how the drug interacts with the drug and the body interacts with each other. So when we talk about that, there is now pharmacodynamics. So pharmacodynamics, this is how the tablet, that is paracetamol, exerts its effects through mechanisms that may be known to the biologists or the pharmacologists. Now there are two mechanisms that paracetamol exerts its effects on the body. One major one is the inhibition of cyclooxygenase enzyme in the body. So those are the two cyclooxygenase, the two COX-1 and COX-2, so that it relieves pain and again fever, reduces fever. And then the next one is the action of its metabolite. Once the metabolism has happened, then the metabolites will also have exert certain effects to the body. Now the next part is now the pharmacokinetics. This is how now the body reacts with the paracetamol inside the within the body. Now majorly paracetamol is ingested, is taken by mouth, and it is rapidly absorbed in the small intestine. So it passes through the esophagus, the stomach, then the emptying part of it. Now at the stomach, at the small intestine is where now absorption is taking place. So the rate of absorption will always depend on the rate of stomach emptying. So, and again now the paracetamol bioavailability is dose dependent. Bioavailability is now how it is found within the body, like point of absorption. So it is dependent on the dose. It is dose dependent, and it increases from 63% of 500 milligrams dose to 89 for 1,000 milligrams. That is 1 gram. So paracetamol it's usually in 500 milligrams formulation, but now some companies also have gone a notch higher to manufacture 1 gram. So that's basically the bioavailability, dose dependent, and its metabolism is done inside the liver. Primarily it is primarily done in the liver, and mainly by glucuronidation. Those two processes, glucuronidation and sulfonation. So, and the products are eliminated in the urine. So mostly when you take in paracetamol, you will usually release it from the body through the urine. That is the main elimination route. And I think most of it we were just talking about, giving you information about paracetamol and what it does. So before we go on, please consider subscribing, commenting, liking, and let's interact more. Challenge me so that maybe we can have a lot of these sessions. Thank you so much. From Field of Dreams Media, we love you. Subscribe. Let's reach 1,000 subscribers as for now. Thank you so much. Paracetamol, universal painkiller.